Yes, sir.
Yeah, yeah,
Yeah, we are live now.
yeah.
Yes.
Very
Good
good
evening,
evening to
everybody.
yes.
Yeah, over to you, Vinod. Yeah, start.
Yeah, thank you, sir. Thank you, sir. A very good evening to all the admitted doctors. Thank you so much for joining us today webinar. Our endeavor is to spread awareness about rabies, which is a fatal but can be avoided our opposite vaccinated. This is initiative from Kedila through this initiative to service the society and humankind. The topic is yeah. The topic is dosage reduction strategy in rabies and management role of novel vaccine. Dear doctor, rabies is the world's first novel 3-dose anti-rabies vaccine with GERB tried. We would like to inform you that rabies has successfully completed 1 year of launch with more than 40,000 patient bite victims in vaccinated. 100% complaints was recorded and no cases of ARD was registered. Yes, sir. With this, my honorable to introduce you to the speaker of today webinar, Dr. Rajarajan sir, the specialty of MD physician, is experience of doctor more than 20 years in this field. Sir has treated more than 20 years diabetic and hyper acidity. Yes. So, thank you, doctor.
Thank you, Mr. Vinod. I would like to thank Cadila Pharma for giving this opportunity to moderate this session. Dr. S. Prasad did his MBBS in Government Medical College, Vellore, and he did his PG in King's George Medical University, Lucknow, and he did his family medicine from CMC, Vellore. Now he is practicing currently in own clinic, Sandoz Clinic in Airport, Trichy. Dr. Prasad is going to deliver a lecture about new strategies in rabies management. I welcome all the delegates and speakers for participants in this session. Prasad, over to you. Let us start this. Talk about new strategies in rabies management. Dr. Prasad, are you hearing me?
Yeah. Okay. Am I audible?
It's audible, yes.
Yes, sir.
Yeah. So, good evening, one and all. And today we are going to have a look about the launch of the new rabies vaccine, which is indigenously made. So, going into the topic, we'll be discussing about the rabies disease in short and about the evolution of new vaccines. So, first, change the slide, please.
Yes, sir.
So 1 minute. Am I audible?
Yes, sir.
Audible. Prasad, continue.
Yeah.
Audible.
Yeah. Rabies virus is a neurotropic virus, and which is fond of infecting the nervous tissues, and it is encoded by live structural proteins, and basically it is a zoonotic disease, and we are more concerned about the G proteins because we use it for the vaccine production. Next slide, please. Yeah. Why we are so interested in rabies? Because the numbers which are shown in the epidemiology are make this disease a global threat, as 59,000 of the deaths of related to rabies are occurring globally per year, and in India it amounts to 20,000 deaths per year, and of these 90% of the deaths occur in rural areas, which is why the disease has to be under our control. Next slide. Yeah. So we already know that this disease doesn't exhibit a iceberg phenomenon, which means any disease, and if this disease occurs, it is totally 100% fatal, and importantly, it is 100% vaccine preventable also if vaccines are administered at correct time. Next slide. Yeah. So this is the history of evolution of rabies vaccines. Initially, at the earlier stage, the vaccines that were available were live attenuated vaccine made from spinal cord tissues, and then it was translated to inactivated vaccines, and in recently worldwide they are using the cell culture vaccines. Next slide.
Yes, sir.
Yeah. So, so what are the current challenges we face while administering this cell culture vaccine? We all know that it is inactivated. It is inactivated form of vaccine, and it has its old 50-year-old technology, and thereby uh, we have many problems like inconsistency with its potency, the stability, as well as the availability in short supplies. Okay. And also, since it is cell cultured vaccine, we get a lot of adverse events also, which we'll be seeing in further studies that are discussed here. And also, most importantly, important point I want to highlight is there is a decreased compliance which is associated with the conventional vaccine, where beyond three injections. Okay. So next slide.
Yes, sir. PL.
Yeah. Next slide. It is about the
VLP.
VLP. Yeah. So we in this I need to highlight some few points about the Trabis vaccine, where we use the VLP technology, which is viral like particle. And we use this engine. We use some diffraction methods to engineer this G protein, and so that this can be instilled into the uh, vector, and we get a new form of this vaccine that is available, and it is a type of some protein subunit vaccine. Next slide. Next slide. That is the slide
Yes.
which is the original research article. The original research article. Uh, Actually, we got this evidence. We got this evidence about the VLP related rabies vaccine from this research, which is conducted by an Indian, okay, and is published in APCRI journal in the year 2021. And this is the foundation for our vaccine, that is rabies vaccine. Okay, let us see some few highlighted points related to this. So this is a phase 2 clinical trial where uh, four doses, that is 10 micrograms of 0 and third day, 10 micrograms given on 0, third and seventh day, and 50 micrograms given on 0 and third day, and 50 micrograms given on 0, third and seventh day. These four groups were compared to the conventional Rabipur vaccine, which is the WHO advised vaccine that is in routine use. Okay, where it is administered in the duration 0, 3, 7, 14, and 28 days was compared. So in this clinical trial, we have five arms, and this old conventional WHO vaccine, which is given for 5 doses, is compared with the new drug, with the new vaccine, which is the VLP derived vaccine, with these duration, that is 0 and third day only, and the other thing is 0, third and seventh day. In the graphs, what we see is the compliance, the efficacy remains the same. The efficacy remains the same for the 0, 3 and seventh day vaccine, which is in comparison with the 5 days regime vaccine. Okay, that is conventional one. Yeah. And yeah, they have also highlighted that safety and immunogenicity of a novel 3-dose vaccine. This is that study which is published in International Journal of Human Vaccine Immunotherapy. Okay, and next slide.
Yes.
Yeah. So once again, they have studied. They have in this study they have enrolled the in phase 3 clinical trial. They have enrolled 800 subjects, which who were randomized into 2:1 proportions, where 2/3 of them were subjected to new vaccine, that is 0, 3, and 7th day regime, whereas the 261 subjects were subjected to the old regime. So the results, next slide.
Yes, sir.
Yeah. Before going to the results, the objective of our study was primary objective was at the 14 days post the first dose, what is the seroprotection rate? That is, we are measuring the rabies virus neutralizing antibody titer. That will be the primary objective, whether this titer equals the conventional regime or not. This was the first primary objective. And the secondary objective was the subjects with seroprotection at day 42 post first dose of test vaccine is monitored in addition to the safety and adverse events. So both the safety and adverse events were compared after 42 days post first dose of vaccination. And the results showed that the efficacy remained the same. That is, the efficacy was 99% in both the groups. 99% in both the groups. That is, with the conventional treatment, that which is the old vaccine trial, and the new trial has the same efficacy. Okay, and this when safety and adverse events profile was compared, it was purely evident that the new vaccine, which is the novel Trabis vaccine, has a very less adverse events when compared to the old vaccine. And even the local adverse events as well as the systemic adverse events were very minimal in the novel Trabis vaccine when compared to the old vaccine. And this needs to be highlighted. So the study concluded that Trabis was non-inferior to the reference vaccine. It has less adverse effects compared to the reference vaccine. In addition, it was found to be safe and immunogenic and was comparable to the 5 doses of WHO pre-qualified vaccine.
Yes, sir.
Am I audible?
Yes, sir. Yes, sir. Clear.
Yeah. So to summarize, it is very clear that this novel Trabis vaccine has more compliance as because it is having only a 3-day regime, that is 0, 3rd, and 7th day, when compared to the conventional WHO pre-qualified vaccine that has 0, 3, 0, 3, 7, 14, and 28. That is, it is too long. But here it is very short. That is, any person who is going outside or any other purpose can stay and finish his dosage within the scheduled week. Okay, so thereby we can make the compliance rate is high with this vaccine. And in addition, since this is a viral virus-like particle derived subunit vaccine, the adverse events and also the safety profile is very good when compared to the WHO vaccine, and which is also evident with the clinical trial that we have seen. So thank you for your patient hearing. So,
Yes, sir.
yeah.
Shall I finish it? Vinod, shall I finish?
Hello? Sir, 1 second, sir. Only 2 minutes, sir. Now I would like to request Dr. Prasad, sir, to take the later. We have a question session, sir. Please.
Yeah, sure.
Sir, Prasad, sir.
Yeah, I'm online.
Yes, sir. Dr. Raj asking one question.
Yeah.
Sir, what is the advantage of 3-dose? Is asking, sir. Dr. Raj.
Yeah. The advantage of 3-dose vaccine, as we have seen in this presentation, it is mainly about the compliance. Our motive is to increase the compliance of the rabies vaccine schedule, as this is very short because it requires only 3 shots when compared to the previous and conventionally available 5-dose regimen. So that is the most important point I want to highlight. And the other thing is, since it is not a cell culture vaccine, which is the previous one, previous old vaccines are cell culture vaccines, thereby which is related to more adverse events and safety concerns. This is purely a subunit vaccine, okay, which is VLA particle derived, which is nanoparticle advised system. And in this, we tend to have relatively very lesser incidence of adverse events. So these are all the important highlights, and it is the which puts this vaccine beyond the conventionally available WHO pre-qualified vaccine.
Yes, sir. Thank you, sir. Thank you.
Prasad, hello.
Yes,
Sir?
yes, sir.
I want to add one point.
Sure,
Yes,
sir.
sir. Sure,
Point
sir.
is the 5 doses serum peak level will reach within 3 doses in this vaccine. That's the main point.
Oh,
The
good,
serum
sir.
peak level will reach within 3 doses. Previously,
Yes,
we are
yes.
using 5 doses. It will reach in 5 doses after only 5 doses. The
Hmm.
serum peak level will reaches within 3 doses with this vaccine. This is the advantage of this vaccine.
Oh, good.
Serum peak level. Okay.
Okay, sir.
Thank you, sir. Thank you, sir. Thank you.
Hmm.
Sir, we are in a closing
Okay,
position,
then.
sir. Yes, sir. Thank you so much, Dr. Prasad, sir, and then Radharajan, sir, for the informative talk. We truly appreciate the efforts. Last but not least, we would like to inform you that Krabis has won 2 prizes award in innovating category, ET India Pharma Award and Golden Global Tiger Award, sir.
Yeah, that's good.
New
Yes,
information.
Thank you, sir. Thanks for coming and join with us, sir.
Thank you.
Mhm.
I had some connection issues, so just why I couldn't.
Oh, it's not a
join.
problem at all. Problem.
Any other questions? Any other questions from audience?
Nothing, sir.
Okay.
Okay, sir. Technical team, thanks for supporting us. Thank you, sir. Thank you. Thanks a lot.
Yeah,
Okay.
thank you.
Thank you.
Thank you.
Thank you, sir.